Senator Braun.
Thank you, Mr. Chairman. It's an interesting discussion because it looks like we're up against a foe that so easily outmaneuvers us. The more you use something that's effective temporarily, the more you're giving it the chance to change and require something different. I got interested in this, and it's, I think, called a spirochete instead of a bacterium, but it's with something that we didn't know much about at all, tick-borne diseases. And then you find out that it's an old drug called doxycycline that's the only thing that can knock them out. And I guess what I'm wondering is, are we in a never-ending battle of where we can never get ahead of this? When you're saying only 1% of any investment in something to, waylay any new malady hits pay dirt, where does this dynamic end? Because it looks like the dynamic generally favors the microorganism. So my question would be, we'll start with Dr. Boucher, what is the most recent example where there's been something so bad, so widespread, where a current antibiotic wasn't working? How long did it take to marshal the resources when you knew that you needed to actually get something to the marketplace that was going to work?
Thank you for your question, Senator Braun. I think we have to look at the example of COVID, right? It's a virus, not a bacteria, but we marshaled, right? And got a vaccine into arms in less than a year, right? And drugs into patients very quickly, remdesivir, et cetera. We can do this, right? The science exists. There are numbers of candidate drugs, vaccines, diagnostics that have advanced scientifically. There's no dearth of science. The issue is really this economic problem, and solving that at the same time as we enact the multi-pronged approach of prevention, surveillance, good diagnostic tests, all the other things that are required to combat this wicked problem. But we live in a country where technology is advanced. We transplant every day. A heart transplant is normal business, in a hospital today.
So we did that in the matter of, because a lot of that research was kind of building towards it, and then it finally got applied. What would you say if that urgency is there? Because sooner or later, it'll be either another virus or a bacterium or even like a spirochete currently, where we have so many more diseases that are out there, tick-borne, that we didn't know about. Thank goodness, doxycycline, very inexpensive, still works. So what would you say when it comes to an antibiotic, not an antiviral, unless they're completely analogous in terms of how you'd get there? Was there anything recently when it's come to something that had to have an antibiotic, and how long did it take?
Yeah, I guess I would say if we look at the most recent antibiotic approval, sulbactam, durlobactam, that was approved for Acinetobacter infections, that's less than 10 years. And that's an infection that we know is coming. It's multi-drug resistant. So this is a game where there needs to be planning in advance for the threats we know and some we don't know. Someone mentioned Candida infections earlier. Candida auris was not on the CDC threat list in 2015. It is in 2019.
And is it one of the biggest concerns right now? And that's
it's a big concern.
Yeah.
So we need infrastructure, and we need something like the Pasteur Act. I think that's the one thing that you all can do, is to advance that bipartisan
so
act.
That we're not doing it ad hoc based upon the very urgent need. Someday that may not be quick enough.
Correct.
Ms. Miller, would you want to weigh in?
So definitely there is a cost in action, and we do need to be planful. We do need to prepare. There is great science out there. It's just waiting to have a stable home to land in. And so if there is one thing that I would ask that be done today, is we need to reform the commercial marketplace. We need reforms to reimbursement. We need pull incentives. We need to fix the commercial marketplace.
Anybody else want to weigh in quickly?
I'll just add one thing, that the PACCARB released a report in March linking pandemic preparedness to AMR, right? This is not if, it's when. And this report goes through all the different aspects that need to be addressed, including the PASTOR Act.
Thank you.
Thank you, Senator. Senator Smith.